The following segment is sponsored by Optum Utah. Today, Dr. Gordon Harkness from Optum Utah is here to tell us a little bit more about prostate cancer and what treatments are available. Doctor, welcome to the show.
Thank you. Thanks for having me.
So what do men need to know about prostate cancer?
Well, it's one of those things that men often don't want to talk about, but it is very common. It's one of the more common cancers, prostate cancers that men get, and it's the second leading cause of cancer death for men, so it's not insignificant.
Right, and you said, they don't want to talk about it, but it's important to talk about it. How many men on average does this affect?
Well, the longer a man lives, the more likely they are to have prostate cancer. And when we look at men that get up into their 80s and 90s, it's nearly 80 or 90% of them. It's a really high percentage. Fortunately, most people that have prostate cancer, it doesn't affect their health significantly. But you don't know, you got to talk with your doctor to get it diagnosed and make sure you know what's going on so that you know if it's going to be significant or not.
Okay, how do you know when to talk to your doctor? What are the symptoms? What do those look like?
Yeah, a lot of prostate cancer, at least in the early stages, do not have any symptoms. But when people do have symptoms, it's going to be things like difficulties urinating or having to go to the bathroom more frequently than you expect you should. Sometimes people have pain in their pelvis area or they notice blood in their urine when they haven't, and there's no reason for them to have blood in their urine, and yet it's there. And so those are some of the more common symptoms. They're not very specific, but if you have any of that, you do want to get checked out so that you can figure out what's going on.
And whenever you come in, you always have hope. There are treatments. Talk to us about that.
Yeah, there's several different treatments for prostate cancer, and it kind of depends on the situation, and it kind of depends on, when you talk with your doctor, what's the right thing for you. But in some cases, they do a surgical removal of the prostate gland itself. In other cases, they'll do radiation treatments or hormone therapies. There's other chemotherapy agents. So there's a whole smattering of different things that can be done depending on the situation, and you really have to talk to your doctor to know what's right for you.
All right, so talking to your doctor, how is prostate cancer detected? How is that done?
Yeah, there's kind of two main ways traditionally that we look for prostate cancer. And so it's important to separate out when you have symptoms, they may do certain things. When you're just getting screened, there's certain things that they'll do. Historically, one of the things we often did was a digital rectal exam. Not the test that people really want to go and get, but it was a method we had to help detect it at an earlier stage. What we found is that digital rectal exams are not actually as helpful as we thought for those without symptoms. The other way that we test for it is with a blood test. It's called a PSA, prostate-specific antigen. So men that have prostate cancer often have higher levels of this in their blood. And so testing for it is a method that can be used to detect it. Again, the PSA test isn't for everybody. In fact, once you get to age 70, there's probably not a good reason to keep testing for that. But again, just talk to your doctor and they'll figure out what's the right thing for you in your situation.
There you go, doctor. Thank you so much for coming in. Like you said at the beginning, it's not something people want to talk